I can see Hilary there. Hi, Hilary. Thanks for joining. And okay. Right. So, welcome everyone to the Latte Lounge. Tonight, I am delighted to welcome Dr. Dahlia Hopmeier. Hi, Dahlia.
Hello. Hi.
Hi. Thank you so much for joining us with us tonight and for waiting so patiently while we just waited for a few of our members to join, but we're really excited to have you here. Now, before we talk, I thought I'd just give everyone a bit of background, Dahlia, in terms of who you are and the work that you do. So, Dr. Hopmeier is a medical doctor with a scientific background in human genetics. She completed a BSc in cell biology and genetics at the University of British Columbia in Vancouver. And prior to completing an MSc in human molecular genetics at Imperial College London. She has genetic research experience in various fields, including cancer and inflammatory bowel disease. And Dahlia also works with Myogenes, which is an advanced molecular diagnostic company centered on personalized health and genetic testing. Now, Myogenes' mission is to bring and develop the field of personalised medicine into the United Kingdom, focusing on personalised genetic testing. They work jointly with medical doctors, genetic experts, and with genetic laboratories located worldwide, really. They distribute genetic tests through doctors' clinics and directly to patients' homes. And they also provide full and personal support to their patients and doctors through their professional experts. And really, there's no more sort of one size fits all. This is personalized medicine, where your body determines what works. So Dahlia, although Myogenes has 5 different types of genetic tests, which obviously we'll go on to talk briefly about at the end of our chat tonight, we're here tonight actually to talk about the psychiatric test.
Yes.
You know, now I think this is something that's really, really relevant, sadly, now. You know, we're hearing,
I agree.
you know, we're hearing, Dahlia, all the time from women in our community who are struggling to find the right treatment options for so many of their family members. And sadly, I know firsthand myself what it's like looking after a child with anxiety and depression. And you know, why I'm really interested to chat to you about this tonight is I've found myself that it can take months, you know, often years to find the right type of medication. You know, in particular, so many of them have unwanted side effects or for whatever reason, they just don't work. Yeah. So listen, let's sort of tell us a little bit about the psychiatric test and who it's designed for.
Sure, definitely. So I'm really happy to be here tonight, and thank you for that introduction. I think what I'll do is I'll share a very short presentation that goes through the main points about the psychiatric test and also explains a bit about genetics and personalized medicine, so we can sort of tie it all together. Let me just start by sharing this. So hopefully everybody can see my screen. And basically, so as we mentioned, we're going to talk about the psychiatric pharmacogenetics test today, even though there are different versions of these tests. And I just wanted to start with this concept of nature versus nurture. And basically what this means is that our health is determined by many different factors. And on one side, we can think of the environment or our lifestyle as nurture. And this includes things like whether we smoke or not, what we eat, if we exercise, and what medications we take. And we know a lot about this already and how it impacts on our health. Now, on the other side of the graph is genomics. And I like to think of this as nature. And it's the underlying part of us that also plays a very important part in our health and interplays with the environment. Now, what personalized medicine does is to look at each person as an individual rather than looking at everybody as being the same or thinking that one size fits all. And one of the ways that we're able to do this now is because we understand more about genetics. And knowing a person's underlying genetic makeup helps you to see them in a different way. So it helps you to see them as an individual and therefore to tailor medicine to be personalized to them, rather than looking at everybody in the same way. And there are many different ways in which you can use genetics or genomics to personalize medicine. And you might have heard, for example, that some people are more at risk of developing cancer. So that's one thing that we can look at in the genes to predict. Then there are also tests now that help us to determine which nutrition and exercise is best suited to different people. And what we'll talk about today is pharmacogenomics. So this means that your genetic makeup can help us decide which medicines will work for you. And this is especially relevant tonight in terms of these psychiatric medications. Now, if we just think about pharmacogenomics, if you have a population of people and you give all of them the same medication at the same dose, some of these people will respond very well, and others will unfortunately not have a response or even have a toxic response, or what we call an adverse side effect. And because we now know that your genetic makeup affects your response to medication, we can put you in your group before even giving you a medicine. So this makes your chance of responding to the medication higher, and also lowers your risk of having a toxic response or an adverse side effect. And we now know that over 100 medications are very much affected by our genetics. And this includes 26 different psychiatric medications, which are actually licensed by the FDA. So they have approved pharmacogenomic rules for prescribing these different medications. Now, the pharmacogenetic test that Myogenes offers is a non-invasive saliva sample. So it's basically a cheek swab, which is very easy to take. And then we carry out a high quality DNA analysis on this cheek swab sample. And it looks at 24 different genes that helps to predict your response to psychiatric medications. And these medications cover a very wide range of conditions, such as depression and anxiety, OCD, PTSD, schizophrenia. So there's really a very large range of conditions that these medications cover. And as Katie was saying, unfortunately, a lot of psychiatric medications don't work initially because we have to go through this trial and error process to try and pick the right medication for each person. And also the mention was about adverse side effects. But so the point of this test would be to reduce this trial and error and to target the medicine from the beginning to actually work for the patient that you're prescribing it to. Now, as I said, so it helps us to predict what medication is most likely to work, which ones are more likely to cause side effects, so therefore you'd want to avoid those. It also helps you determine the correct dose of the medication. So it doesn't only tell you whether or not a medicine is a good idea, but it also tells you how much you should be taking. Then there are some additional quite interesting points in this test. For example, we have a gene that is linked to the mental health benefits of exercise. So some people seem to benefit more than others, even though everybody does benefit. But this is quite an interesting thing. Then there is also a gene that is linked to what we call being a warrior versus a worrier. And this has to do with your adrenaline levels and the way in which your body processes adrenaline. And then there are other things. For example, certain people can't activate some vitamins and in the body, for example, methylfolate. So sometimes you need to give this to aid mental health as well. And basically, we can talk through any of this again with any questions you have. But the main point really is that pharmacogenetic testing doesn't lead to improved mental health outcomes. There's very good evidence now that this is in fact true. And this is, I think, the way in which medicine in general, but especially psychiatry, is moving. Great. So I'll stop sharing the screen now and we can have more of a discussion.
Thank you. That was, I mean, that was absolutely fascinating, you know, for me as well. Let's just rewind a little bit, because obviously that was quite a lot to take in.
Yes.
So this is obviously identifying, as you said, what people are more likely to respond better to, or so how do you do the test? So if say there's a parent here and their child is on antidepressants at the moment or anti-anxiety medication, and things are just not working as quickly as they'd like, or they're getting unwanted side effects, and one of the mums perhaps, or dads have seen this video and they're interested in this test, what do they actually have to do? Is this something that they apply online through the post, or do they go in and see a doctor? How does it actually work?
Sure. So there are a few different routes into how this works, but the most common route is that, so we need a doctor to be the person who will sign the form, basically, to request the test. Because one of the things about Myogenes is that any medical test like this, we want it to be in the right hands. Mm-hmm. So we don't want people to just order things off the internet and then not know what to do with the results. So a medical professional needs to order the test. And that can either be your own doctor that you go to and ask to do this, or it can be a doctor employed by Myogenes. So sometimes I sign test request forms for people. Mm-hmm. Then once that's done, the sample, which is a saliva sample, just needs to be sent to Myogenes in the post, and then that is sent on to our labs. And after that, a confidential report will be generated, and that will be sent to the doctor. Now, the doctor will then contact the patient and go through the results with them. And one added benefit of the Myogenes package is that the doctor has access to our labs and to health professionals as well. So if they want to ask questions before seeing the patient, that is included. So you can have a consultation.
Okay, so what psychiatric conditions can this test help with? I mean, I'm assuming depression and anxiety. Does it cover things like OCD, ADHD? Yeah.
Yes, it does. So it basically covers any psychiatric conditions where medications are commonly prescribed. So it's basically all of the common psychiatric conditions.
So obviously, I'm bringing it in much more into our community and how women come to us. So we have women that come to our Facebook group and say, can someone recommend a psychotherapist or a psychiatrist? My son or my daughter's really been struggling for months, and we're just not really getting anywhere. Now, do most psychiatrists in this country and doctors know about Myogenes, or is this something that a patient almost has to learn about themselves and request and ask for?
So we definitely have become more well-known. Also, the fact that genetics is a lot more mainstream has led people to search for companies such as ours. Mm-hmm. In general, I would say that we also have a list of psychiatrists who use our test regularly and can also be used by people who would like to perhaps have a new insight into their condition. So that is another thing that's possible. Yeah. I just think that even if it's just in terms of the pharmacogenetics in general, people are starting to use it a lot more. So this is going to become the norm. It's sort of on the way there already. And in some cases, it's already becoming a standard of care that psychiatrists feel that they can't prescribe without this information because we know it. So we should have a duty of care to use the.
Oh, I think your Wi-Fi has just cut out a little bit. That's fine.
Sorry.
It's fine. Now, there may be a lot of skeptics. I've been brought up by a doctor and his question to me whenever I talk about anything is, show me the evidence. So I'm obviously going to play devil's advocate a bit here. What evidence is there that taking these tests actually will help?
So we've got an extensive body of evidence now based both on our specific test, but also pharmacogenetic testing in general. And what we have available is what we call the white paper, where we can send you all the research background of each of the genes, and then also the trials that have been run, which basically show that using pharmacogenetics improves treatment response over some seminal trials. There was a very important trial in psychiatry called the STAR-D trial, which basically used a stepwise approach to treating different conditions, especially depression. And what we saw was that with the pharmacogenetic tests, your response rates far exceed that trial. So there is good evidence that it does work.
Okay, great. Now, how long will the results take when someone does this test? And obviously,
to my knowledge,
sorry, I was just going to say, how long does it take? And obviously, is there a professional who will then go through the results with you?
Sure. Yeah. So to my knowledge, it's about 2 to 3 weeks. And there will always be a health professional to go through the results with the patient. So that will either be their own doctor or one of the doctors they use for Myogenes.
Mm-hmm. Okay. And is there counselling available? You know, often it's, I always think that when people decide to go for a test, there's always going to be, there's going to be two outcomes. There's either going to be a really good outcome where you've got the result you want, or possibly, you know, a negative outcome, which is very worrying and then can cause anxiety and further tests. There's even the kind of worry and anxiety before you decide to take a test. So is there counselling available before to kind of talk you through what may happen, and then obviously at the end, once the results come through?
Yeah, definitely. So what is available is for everybody, there's what we call an informed consent form,
Mm-hmm.
which goes through all of the points about the testing. And then if they would like additional counseling, they can contact Myogenes for that. And then that is a service we can offer as well. This is especially relevant, I think, for the cancer tests, but is possibly less relevant for the pharmacogenetic testing. Because in a way, although it has very important implications for your medication, it doesn't diagnose you with a condition.
Yeah.
So it's slightly different in that way. And we find that most people want pre-counseling for the cancer tests, but not the pharmaco tests.
Right. And is this available for people living outside the UK?
Yes. Yeah, it is available.
Okay, that's brilliant. And so they don't have to see their doctor necessarily to complete the test. What if it's a child? How old do they have to be? Is there a sort of minimum age?
So there is generally not a minimum age that we need a child to be, but the parent will have to obviously be the guardian and the representative for that child. And so we would have the discussion with them and what the reasons for testing are. And actually for the psychiatric test, we found that for children, sometimes it enables psychiatrists to then prescribe things that they would otherwise not have been confident to do. And they can go slightly off label and prescribe things that might not be usually used in that way, but the genetics support that it would actually work. And so therefore then they can prescribe it.
And what happens if they're already on medication? Does that affect the outcome of the test, or?
So it does not affect the outcome of the test. Medications will not alter your genetics, but what it can do is we can explain why certain things worked or why didn't. And I find people find that very interesting, because it's actually the most common scenario is people who come to us who are already on medications but haven't gotten the desired effect from them.
Yeah, absolutely. And who, I just sort of from a sort of more of a security side of things, who has access to these genetic test results? Do you keep them confidential, or are they shared amongst certain professionals?
Sorry, I'm sorry, you cut out a bit. Could you just repeat the last sentence?
Dahlia. Yeah, just in terms of security, who has access to the test results? Obviously, you know, they're confidential. So are they just shared between the doctor and the patient, or do the lab, you know, get to see everything too? And
so the lab will send a confidential report to the authorizing clinician. The lab, apart from the people who've analyzed the sample, will not see the results. And they will then send this report to the clinician with different passwords, so it's encoded. And then that clinician will share the result with the patient. And the patient can then decide who they want to share the results with. So sometimes they will take the results to their GP, for example, and want it on their record, while others don't, and that's up to them.
And if you've got private health insurance, does this cover genetic testing, or is this a private arrangement? And also, is this the same test that's used in the NHS, or do they use it on the NHS?
So the insurance question, certain insurance companies do cover certain tests. So we know that some big insurance companies now cover, for example, the BRCA testing for the breast cancer genes. In general, as far as I'm aware, most pharmacogenetic testing is not yet covered on insurance. So that would be more of a private arrangement.
Right.
Yeah. And sorry, what was the second question?
Well, I just wondered if it's used on the NHS. Is it the same test that they use, and is it available?
So pharmacogenetic testing is available on the NHS to a limited extent for very specific scenarios. It is not available in general for screening, for example, before you would like to start a medication. So at the moment, most of these tests would have to be done privately, but there are some examples that the NHS does use as well.
So before we talk about the other tests that Myogenes offers, just give me an example. So if, say, for example, it's my child and he's been on antidepressants and we haven't got the right thing, we do the test and the test results come back. Does it actually say you should try these type of SSRIs, or you actually need an anti-anxiety rather than an antidepressant? I mean, does it actually spell out does it give lists of the drugs to try? I mean, does it literally sort of zone in on one, or is it giving the psychiatrist or doctor a few to choose from?
So what our test does is go through each gene and each medication, basically. And depending on what the medications that the person was already taking, we also have what is called a condition summary. So for example, let's say a patient has depression and we know that they were taking sertraline. Yeah. We then get a result that says use caution with sertraline, but then it will tell you all the other examples that could or could not be used. So for each medication, it will tell you whether or not we recommend that the person take it or not. And then you also get it in a graphical form. So it's nicer to look at, that basically puts the medications on a chart that says good, bad in the middle. Yeah. So that way you can choose based on all the information put together. And the other thing is that there is a software that the clinician can then also access, which allows you to calculate the interactions with the genes and the drugs, but also with your lifestyle factors. So for example, smoking or drinking alcohol can also affect how you metabolize medications, and other medications affect other medications. So you can put all these factors in to make a plan.
Right.
Your genetics.
I mean, it sounds revolutionary to me.
Well, we think so.
I mean, it really does. Now, let's just talk briefly, before I ask if we've got any questions from anyone, talk to me about the other tests that you offer. The one that I think a lot of people will be interested on the group, and I am from a sort of point of view as a daughter of a breast cancer surgeon, the BRCA gene test. Talk to me about that one first. Yeah.
Sure. So we have what we call our inherited breast cancer panel test. This looks at BRCA1 and 2 genes, but then also at 13 other genes that are known to be involved with breast cancer. For example, PALB2 or CHEK2. There are various other ones. And the reason I think that our test is so good is because it doesn't only look at very common variants of these genes that can cause cancer, but it looks at the whole gene. So the whole, what we call exon, it looks at the whole exons. And even if there are new variants that we've not seen before, those do get reported. So we have a very clear insight into the person's genetics with that test. And it's very accurate.
And that's also testing for ovarian cancer as well, the gene that's responsible.
Yes, so the most common known causes of ovarian cancer are also BRCA1 and BRCA2, because breast and ovarian cancer are often inherited together. So in that way, it does test it. We do have another test, which we call our whole cancer gene panel. And this looks at 98 different genes for all kinds of cancers. And some of the ovarian cancer genes, they are slightly different. So they're additional to that. But the BRCA gene test will give you some information about ovarian as well.
Okay. And this is where, as you said, and I'll just repeat, I think it's really important that if women, you know, if there has been a family history of breast cancer or ovarian cancer, and people are, you know, really keen to do the BRCA test, I think it's really obviously important to get some counselling beforehand, you know, with your doctor or whoever it is, with your specialist. And then if you're offered this test, or you choose to do the test through Myogenes, that someone is counselling you afterwards and holding your hand throughout, because I think it's a very worrying time in particular.
Definitely.
Talk about there's 3 other tests, is that right? Genetic tests?
So I think we talked about the 2 cancer ones, so the breast cancer panel and the whole panel. Then we talked about our psychiatric pharmacogenetics one. And we have another pharmacogenetic test, which looks at a broader range of medications for all kinds of conditions. So that would include things like your cardiac medications or pain medications, really anything you can think of. So it's a much bigger test.
Right.
But the concept is exactly the same as the psychiatric one. We look at the genes to predict which medications are the right ones for you.
So they're not predicting, oh, sorry, didn't mean to interrupt. They're not predicting the likelihood of possibly going on to get heart disease. They're predicting the right medications should you need them, and you're coming for that reason.
Exactly.
Right, okay.
Exactly. Yeah. So it's not a diagnostic test for medical conditions. It's a guide for giving you the right medicine.
Okay.
Yeah.
And then there's a health and well-being one.
Yes, exactly. So this is the only test that actually doesn't need a healthcare professional. It's lifestyle based. So it tells you about your diet and the nutrients you may need, which exercise you might benefit from. So it's a slightly more lifestyle oriented one. And that one can actually just be ordered by the person themselves.
And is that looking for deficiencies in your diet?
It's more looking at your risk of certain things. So for example, some people might have a higher risk of being gluten intolerant.
Right.
So then that would tell you that. Or some people would have a higher risk of wanting to eat a lot of sugar. Yeah, so it will tell you more about that rather than your actual deficiencies at the time.
Right. Okay. And we've got just a couple of minutes left, so I'm just going to quickly ask if anyone is watching and wants to ask any questions, please ask in the comments section, or if you want me to ask anonymously to Dahlia, just drop me an email at katie@lattelounge.co.uk, and I will forward them on to Dahlia to answer privately. So we're just going to have a quick look. Tammy says very timely. Yes, it is. I mean, there's during this pandemic, it's just been the amount of emails we've had, messages from women about, you know, mental health. I think we're heading into a mental health pandemic, which is sadly going to be far worse.
Yeah, definitely.
Well, I mean, it's all pretty shocking. So listen, Dahlia, before we go, how can people find out more about the test? Can you just tell everyone your website details?
Sure, yeah. So it's just www.myogenes.com. And also our CEO, Claire Brenner, is very happy to take any emails. And that's just Claire, which is without an I. So CLARE.Brenner@myogenes.com. She's very happy to respond to any queries by email as well. And you can contact us just straight via the website too.
Okay, that's brilliant. Well, thank you very much for joining us. And what we're going to do, we've recorded this because obviously a lot of people can't watch live, and we're going to share it on our YouTube channel, and we'll embed it in a blog from Dahlia on our website. And obviously it will be pinned to the top of this Facebook group so people can re-watch whenever they want. So thank you so much, everyone, for joining us. It was really fascinating. There's a lot to take in. I think I'm going to go and re-watch it myself tonight, and I'm sure I'll have loads more questions for you tomorrow. So be well, and thank you so much for joining us. And
very welcome. Else. Thank you for having us.
Pleasure. Have a good evening.
You too.
Bye, everyone.
Bye-bye.
Bye.